and 23rd tomorrow this year. So this is to cordially invite all members and non-members of KPA Nairobi branch to this year's annual scientific conference scheduled for today and tomorrow here at the Sportsview Hotel, Kasarani, Nairobi. The KPA Nairobi Annual Scientific Conference is the branch's signature event that unites members and healthcare professionals for the 2 days of learning, networking, and innovation. This year's AC features top-tier speakers, including government officials. The conference offers CPD-accredited sessions to help participants stay current in their field and meet the annual licensure requirements. The upcoming branch AC is designed to deliver the following key outcomes. Keynotes from various agencies' top officials, latest trends and innovations in pharmacy practice, and CPD points for license retention, connect with peers and sector peers, direct access to industry influencers, alignment with CPD accredited content, enhanced brand recognition among practitioners, among others. So the theme of this event shall be transforming pharmacy practice, of course with several sub-themes. So the charges for this conference shall be 3,000 for the paid-up members, 3,500 for the non-paid-up members, 4,000 for the virtual. So we welcome you to this event. Come learn, network with fellow professionals as we shape the future of the pharmacy practice together. Thank you and karibuni sana.
Asante sana. She deserves a better clap. Thank you once again. Just allow me to bring to your attention that we are having a blended event, which means as much as we are here physically, there's a good number of our colleagues who are joining us virtually worldwide, not only in Kenya, and even across borders. And to that respect, allow me to take this opportunity to recognize our members who are joining virtually, and let's just clap for them. So for the virtual attendees, we are together in this, and let's celebrate our 23rd Annual Scientific Conference. Again, it's worth noting that this 23rd Annual Scientific Conference, we, as KPA Nairobi branch, we care about the future of our profession. And in us, joining us physically, we are privileged to have 4 colleges offering diploma in pharmacy students in this conference. So allow me to take this opportunity just to recognize them. If you are a student in this conference, you can just rise. Students, yes. So we have students from the Kenya Medical Training College. We have students from TUK Technical University of Kenya. We have students from Kabete National Polytechnic. Then we have students from NTTI, and I request the student maximize this rare opportunity, interact with your colleagues, and by the time the conference will be ending, ensure that you have new contact. Asante sana. Stay put. We will give you an opportunity so that you can tell us something. Asanteni sana. Now, without much ado, our 23rd Annual Scientific Conference is themed Transforming Pharmacy Practice, Fostering Patient Care in the UHC Era. Allow me to use this opportunity to welcome my boss, the chair of KPA Nairobi branch, to come and give the opening remarks. Na tumpigie makofi mpaka afike.
Thank you. Thank you so much, our Chief Moderator, Calvin. I'm very happy and to see the bright faces that have come today for this conference. So, wana KPA Nairobi branch, hamjambo. Hamjambo tena. Yes, karibuni sana. And before I give my remarks, we are having our 23rd ASC, and therefore, among the delegates that are here, if you turned 23 today, please register with the office admin, and I will see you after this address. So I know those who will say that they are younger at heart, like Mzembogwa, but those who whose ID indicates that they are 23 today, please register with our office admin. So, as we begin our 23rd annual conference, I want to greet you in the name of the Lord, our esteemed guests, partners, pharmacy students, friends of KPA Nairobi. It is with great honor that and humility that I welcome you to the 23rd Annual Scientific Conference of the Kenya Pharmaceutical Association Nairobi branch, which is happening here at Sportsview, Kasarani. I extend my deepest gratitude to our organizers, facilitators, sponsors, and every participant who has made the effort to be here. Your presence is a testament to the strength and unity of our profession. This year's theme, as has been read, could not be timely. And as Kenya advances towards UHC, universal health coverage, pharmaceutical technologists that we are have been at the forefront to innovate power. Okay. To innovation, regulation, and patient-centered service delivery. We have constantly shown that ourselves as the custodians of health, advocates of patients, and partners in the broader healthcare ecosystem. Over the next 2 days, we will engage in discussions that reflect the breadth and depth of our responsibilities. As professionals, we must embrace leadership and management as critical drivers of change in our profession. We must foster research, uphold ethical standards, and ensure that every Kenyan citizen, from urban centers to the rural villages, benefit from safe, effective, and affordable medicines. The sessions on research methodology, medical adherence, AI, and innovation reminds us that our work is not static. It is indeed dynamic and requires continuous learning and adaptation. Let this conference be more than a gathering of minds. Let it be a platform for forging partnerships, for challenging ourselves to think differently, and for committing to actions that will transform pharmacy practice in Kenya and beyond. Together, let us commit to a future where pharmacy is not just a profession, but a calling to serve, to innovate, and safeguard the health of our people. May this conference inspire us to lead boldly, collaborate widely, and act decisively in the UHC era. I thank you all and look forward to the fruitful discussions, collaborations, and innovations that will emerge from this conference. Let us make these 2 days a turning point to our collective journey towards a healthier, more equitable Kenya. I am yours sincerely, Anthony Bitu, the chairman, Kenya Pharmaceutical Association. Feel welcome and feel at home. Be ready to engage. And before I hand over the microphone to the moderator, I want to say that I do not work alone. I have my team here, and this for the benefit of the new people who are with us here. I have my team here. That is the branch executive committee members. I have my secretary here, my brother, Cletus Otieno. Just for the benefit of those who have not seen you of late, that is the branch secretary, Cletus Otieno. I also have the moderator. It is good I introduce you to these people. You just introduced yourself. That is Calvin Otieno. If you attend our webinars, this is now you can put the face to the voice. The deputy secretary, who just read to us the notice of the meeting, Linian Kadunda. Then we have, recently we appointed a new treasurer, that is Laura. Laura, if you are around, I will bring her. We on the mama yetu for now. Yes. There she is. Please come. We cannot be turning our heads to see you. And then I am deputized by Josephat Karuri. Josephat Karuri, if you are around. Then we have an extension of Nairobi branch leadership where we have the subcommittee members, several of them. If you are a subcommittee member and if you are here, kindly rise up. We see you. Subcommittee members, I can see the lovely ladies, the gentlemen there. Yes, those are some of them, and they have been allocated several duties here and there to ensure that everything goes on well. We can sit. So our treasurer is there, Laura. Yes, we on the mama yetu for now. So you can always be sure that Nairobi branch is running. And we also have a guest here who is here, Mzee Mbogwa, who is our chair board of trustees. Whenever kuna ish hapa na kule, huyu ndiye baba yetu. He takes care of all issues that happen within KPA. So asanteni sana, karibuni sana, and be free to engage with everyone and anyone within the premises of this conference. Asanteni sana na karibu sana.
Thank you, team. And that's your chair, our beloved chair, KPA Nairobi branch has officially given the opening remarks for our 23rd annual scientific conference. Asante sana Bwana Chair. Now, nataka tukubaliane. We have a packed day na hatujaanza. So nataka tukubaliane, tuwe tayari so that we cruise together for the day. So our time is much spent, and I want us to take a short break. We are going for a working tea. So I'm requesting that we take 30 minutes. Tea is ready, and you use that 30 minutes to serve your tea and mingle at the exhibition, exchange that contact, and at 11:30, we all come back to assemble here and we start the packed program. Si tumesikilizana? Yeah, so allow me to release us all and let's interact outside there as we enjoy tea. Thank you.
Because if you didn't give me that opportunity, maybe to be your leader at the branch level, I would not have been where I am today. So I'm very happy, and I came to say thank you. So those who don't know me, my name is Sarah Kisilu. Currently, I'm at the board, and I'm also the chair, Risk and Audit Committee. I'm also in technical committee, and I'm also in inquiries and disciplinary committee. So please, my members, tusipatane kwa makosa. Sawa? Asanteni.
Thank you. Thank you, Sarah. I think I'd call on Dr. Kadiambo, please.
Good morning.
Good morning.
Okay, I'm glad to be here again. I was here about 2 years ago to give a scientific talk. Today I'm here as part of government, Serikal. Okay. So things been to sometimes. I'm Dr. Maurice Kodiambo. I'm a member of the Pharmacy and Poisons Board. I am a member of this committee, the Practice Committee, but I also chair the Ethics and Disciplinary Committee. So as Sarah has asked, please tusikutane huko because we are friends. Try your best. Thank you.
Thank you. Thank you, Dr. Kadiambo. Maybe we can have Mr. Mayu, please.
Yes. Cynthia, Honorable Cynthia, I think for those who come from Nandi, Governor to come next year. Okay, my name is Mayu Kimutai, member of Pharmacy and Poisons Board. I think I've been coming all these meetings, and I told Dula to sit next to our women rep Nandi to invite us specifically to Mombasa conference. So that's the reason why we interchange some space. And if possible, please invite the entire team of health committee to that place. And members, most of your issues can be sorted, not by Pharmacy and Poisons Board, but when you work closely with health committee of the health committee of Parliament, where Honorable Cynthia Muke is one of them. She will assist you in terms of the laws and other issues, and I prefer that you find a better way of working, and the chair of that committee is Nikal, Honorable Nikal, James Nikal currently. So I think most of the things you normally bring to the board are misplaced, but the best place to converse is Parliament. And then let me just stop there. I am member of this practice committee. If something goes wrong in practice, members are normally invited to go to ethics and disciplinary, where Dr. Kodiambo is chairing. And Kodiambo has been very good friend of KBA, giving you CBD talks, isn't it? I don't want to talk more than that. Let me end there. Thank you.
Thank you. Thank you. So for those who don't know me, my name is Dr. Isha. I chair the practice committee at the board, but I also sit in ethics and disciplinary committee. So I am here on behalf of the Pharmacy and Poisons Board, and I will read out the speech. The President and the members of National Executive Council of KPA, members of the Nairobi branch, distinguished guests, ladies and gentlemen, good morning. It's good afternoon now. Good afternoon. It's a great honor to join you today at this annual scientific conference. I bring warm greetings from the PPB chairperson, board members, and the management. Allow me to sincerely thank KPA for creating platforms such as this that promote constructive engagement with the profession. Such forums are important in strengthening collaboration. I'm hoping he doesn't like my speech. Such forums are important in strengthening collaboration, building mutual understanding, and jointly shaping solutions that support both professional practice and effective regulation. Ladies and gentlemen, the pharmacy profession occupies a uniquely trusted position within our healthcare system. Pharmacists and pharmaceutical technologists are amongst the most accessible healthcare professionals and play a critical role in patient safety, public health, and access to quality care. Today, Kenya's pharmaceutical sector continues to grow significantly, with the board currently overseeing more than 10,000 licensed pharmaceutical premises, including over 7,293 retail pharmacies, 2,019 hospital pharmacies, and 467 licensed pharmaceutical wholesalers. This expansive and rapidly evolving landscape demonstrates both the importance of the profession and the increasing responsibility placed upon regulators and practitioners alike to safeguard the integrity of the pharmaceutical supply chain and protect patient safety. However, regulation is not merely an administrative obligation. It is a public health responsibility aimed at ensuring that health products available to Kenyans are safe, effective, and assured of quality. To this extent, in recent months, the board has intensified oversight across the pharmaceutical supply chain through inspections of wholesalers, distributors, and retail pharmaceutical establishments. So as you had brought in earlier, actually the wholesalers have been inspected. For instance, following intensified inspections of pharmaceutical wholesalers between January and April 2026, out of the only 467 establishments out of the 700 that had been operating last year were found compliant and consecutively licensed by the board. That's quite a big number of people who didn't get relicensed. In the last 3 weeks, the board has conducted risk-based inspections of retail pharmacies across the country, leading to the arrest of 95 persons found to be operating in non-compliance with GSDP requirements. These efforts are intended to combat falsified, substandard, and illegally distributed medical products and to strengthen compliance with good storage, distribution, and pharmacy practice standards. Amongst the tools put in place to support these efforts are the GPP guidelines that clarify standards for premises operations and professional practice. At the same time, the board is exploring appropriate regulatory frameworks for pharmacy value-added services such as family planning, disease screening, vaccination, and other patient-centered services that support primary healthcare and universal health coverage at a whole. The board is also aligning reforms with the broader health sector transformative initiatives, including Practice 360 and implementation of integration with Social Health Authority, with the aim of strengthening quality assurance, accountability, digital integration, and continuity of care. The board's work remains aligned with government priorities, including UHC, and the constitutional right to the highest attainable standard of health, while strengthening regulatory systems in line with international best practices. Ladies and gentlemen, the strength of any profession depends on integrity and accountability. The board remains concerned about malpractice, including license, renting, and leasing, absenteeism of superintendents, forgery, and unlicensed practice, and also sourcing of medicines from unlicensed suppliers. Such practices undermine patient safety, public confidence, and the credibility of the profession. These practices also directly contribute to antimicrobial resistance as a growing public health threat. Responsible dispensing practices, particularly adherence to prescription-only requirements, such as drugs for antimicrobials, are essential in preserving treatment effectiveness and protecting public health as a whole. While the profession is founded on self-regulation, the board will continue strengthening its enforcement and disciplinary mechanisms, including the work of the inquiries and disciplinary committee, wherever serious violations are established. Accountability must extend to all persons involved in pharmaceutical operations, including the proprietors, directors, and the superintendents. Sustainable regulation, however, requires partnership. Today is an example. The board values continued collaboration with professional associations, training institutions, healthcare practitioners, the industry, and other government agencies to strengthen coordination, compliance, and public protection. Ladies and gentlemen, allow me to briefly address the CPD concern. These concerns raised by stakeholders have been noted, and the board is engaging on measures to continually improve the CPD system, including rationalizing the timelines, enhancing the efficiency, and addressing genuine operational challenges. At the same time, CPD remains an important professional obligation that supports competence, lifelong learning, and quality patient care. As we gather here today, let us remember that the ultimate purpose of our work is to serve humanity. Every prescription dispensed, every inspection conducted, and every professional standard upheld ultimately affects the well-being and life of a patient. Let us therefore continue to uphold professionalism, ethical conduct, scientific excellence, and patient-centered care. Together, we can strengthen public confidence in the profession and contribute to a safer, stronger, and more accountable healthcare system for all Kenyans. With those remarks, I thank you for your attention, and I wish you a fruitful deliberation for the next day and a successful conference. Thank you very much for having us here. I hope you're not going to ask me any more questions. Hard questions.
Yeah, we recognize that you are barely 6 months in office, and therefore we may not ask you hard questions. All right, so ladies and gentlemen, Honorable Chief Guest of Honor, in the past few years, KPA has engaged in a deliberate efforts to expand the scope of practice of the Kenyan pharmaceutical technologists. And through that, we have been engaging on several family planning training courses for our members. In the past 1 year, we have been able to train over 400 members across the country. These people get their trainings. It is a 5-day training, 2 days practicum and 3 days theory. And then they continue with practical sessions where they are given logbooks, and those logbooks are taken to the Ministry of Health and get certified. Thereafter, they are issued with accreditation certificate that shows that they are accredited to provide quality family planning services at their community pharmacies. We have a number of them here. Lastly, recently, we also negotiated with the stakeholders, including the Pharmacy and Poisons Board and Ministry of Health, to recognize these pharmacies officially. And therefore, we got just that. So currently, we have unique identifiers that then differentiates these community pharmacies from those that have not been trained. And as such, today, we have the honor, I don't know the cameraman, if you can zoom in. So we have the honors today to launch officially unique identifier for the pharmacies that have been trained across the country. This is just a sample of the Nairobi County trained pharmacies. And it reads, I know this person could be here, Haron Kibe enrollment number that Harry Care Chemist is certified by the Ministry of Health to offer short-term family planning services. This has the Ministry of Health logo, the Pharmacy and Poisons Board logo, our Blue Cross logo, and the KPA logo. Can you clap for this? This is a great milestone towards expanding the scope of practice of the pharmacy, of the pharmaceutical technologists in the country. And today we have the honors to launch this, but also to issue the unique identifiers officially for the first time, and the issuance shall be done by our guests in the room. I would request assistance to be provided. Yeah, so I would request the members of the Pharmacy and Poisons Board to flank the chair for this ceremony. All right, so today we will just issue sample of the members we trained. And in the list, the one that I've just read, Haron Kibe, if you're in the house, please come. The next is Cornelius Lumiti Luyanje. Please go. Si lazima. Moses Wanjama. Maragia Augustus Oyaro. All right. Eric Luangu. Chief guest of honor, amongst us also are members who are also interested in political seats, but not in the governor of Nandi County. All right, so for your information, our chief guest of honor has a very rich history. She was the first youngest member of County Assembly, MCA, Nandi County. And currently she is the women rep, Nandi County. And next year, she will be the governor, Nandi County. And for that reason, Chief Guest of Honor, we have within us also a member who is yearning for a political seat to start where you started from, as the member of County Assembly representing Umoja 1 Ward. He is called Mark Midimo. So, Chief Guest of Honor, we would request you to give Honorable to come. Mark Midimo, if you are in the house, to please come and award and give him words of encouragement. Is he in the house? All right, so just come, Chief Guest of Honor. Yeah. Maragia Augustus Oyaro, come. Please. Sarah Mutua. Christine Wanjiko. Yeah, please have the honors to issue Sarah Mutua. Christine Wanjiko. Pigieni makofi tafadhali. Thank you so much, Honorable Chief, Guest of Honor. We appreciate. Allow me to call the chair at this juncture to welcome officially our Chief Guest of Honor. Nipigieni makofi tafadhali, hata na mimi. Asante sana.
Thank you so much, Secretary Cletus Otieno. It is now a great honor and with humility that it is time that we welcome our Chief Guest of Honor, who has been with us for quite some time, since 10 a.m. She is very dedicated, and it is good that being a member of the Health Committee in the National Assembly, where we have friends in that committee, that she comes and addresses our meeting, and to officially open this conference now on. So members, KPA Nairobi, I would like us to show our chief guests that we are the branch. Whenever we are out there, whether within Kenya or abroad, as it's also important, I mentioned to you that this conference is hybrid. We have our members who are abroad. They are following this conference. So now, it is now the great opportunity for the branch to welcome our chief guest of honor. And this is how we are going to do it. We are going to do 4 claps, 3 claps, 2 claps, then Adhanras Krap to welcome our guests. So let us all arise and welcome our chief guest. Let us start as she comes. 1, 2, 3, 4. 1, 2, 3. 1, 2. Thank you so much and welcome our chief guest as you address this conference, opening it officially. Asante sana. Yes. Karibu sana. Yes.
Thank you very much, Chairman, Nairobi branch, the esteemed members of this branch. You know, I'm sure everyone is wondering how I ended up coming here or how was my name floated until I am here. So allow me to clear the doubts and the speculations in your minds right now before I say a few things. I am Cynthia Muge, Mrs. Rutich. I come from a village called Kapserton in Nandi County, a ward called Kipkaren, and a constituency called Mosop. That is Nandi County. That is where I come from. I am here today in my capacity as a member of the Health Committee, National Assembly. I have been a member since September 2022 when I was sworn in as a member of parliament representing the great people of Nandi. I have been serving in that committee for the last 4 years or so. I am here because of a friend that is a friend to this Nairobi branch, that every time that you have this conference, he makes a point to come, the Honorable KJ. He's been coming to this conference a lot of times. And because KJ was really busy, he reached out to Bwana Karuri, and KJ thought that I was a better placed and fit replacement of his absence during this particular 23rd conference. And I said, why not? Even if the shoe does not fit me, I will shoe my own, and it will definitely fit me. And that is why I am here today. I am very happy that Dr. Isha was able to give her speech before I did, because good people, I am a politician and response on their feet. I am not able to probably sit down and come up with a speech, but you know what? I will learn and I will be a very good student while at it. So thank you very much for having me. I want to recognize the leadership of the branch led by the chairman. And I must say that this is the first place that I have seen devolution in action. Most of the places that you go, you find that people call the deputies or the vice chairs, they call them vice chairs instead of the deputies, because that is what devolution came up with. So I found out that the Nairobi branch has been in a good place, because it knows that what you need to call the vice is actually the deputy. Like the President of the Republic of Kenya was the first deputy president in Kenya, because the others were vice presidents. So it looks like muko na rada mzuri kabisa around here. Allow me to try and pull my formal address, because it looks like this is a very important function, and it is a function that I was telling the members, the chair, board of trustees, Bwana Mbugo. I was telling him, I don't know where I was hiding and I don't know what I was paying attention to, because this is the 23rd conference, and all this time until recently, I have not paid adequate attention to this particular conference. And I want to say asante sana to the organizers. And of course, when I was preparing for this particular address, I bothered myself to look at the items and the things you've been able to do. And I realized that the conference that happens in Mombasa is more popular, of course, followed by the one that happens in Nairobi. And I'm wondering why. But I will be knowing why, because I have also been invited to the North Rift one on 30th, that is Saturday or so, this coming week. I will make a point of being there so that I can be able to appreciate what the pharmaceuticals do. So distinguished guests and representatives from government, because I have seen the Pharmacies and Poisons Board here and all the regulatory bodies that are here, the officials of the Pharmaceutical Association, members of the Nairobi branch, the delegates that are here, the partners, because I have seen a host of partners around here. The ladies and gentlemen, good afternoon. Of course, it's a great honor and a privilege to join you in this beautiful afternoon for the for Kenya Pharmaceutical Association Nairobi Branch Annual Scientific Conference of 2026. I am made to also understand that the Kenya Pharmaceutical Association Nairobi Branch
is able to bring together thousands of pharmaceutical technologists that are either seated here, watching back at home, and I have been sufficiently informed that there are others who actually stay abroad, but they are proper members of this particular branch. I am more interested and intrigued by the theme for this year, 2026, that says transforming pharmacy practice and fostering patient-centered and integrated care in the UHC era. The mention of UHC is more than dear to my heart because we all know what it stands for. This is not just a theme, it is a theme that is highly timely, and it is also relevant as Kenya continues in its journey towards ensuring that we all achieve the universal healthcare coverage. And I want to say this, scientific conferences such as this, they are not just formal gatherings, they are actually the engines that we need for us to be able to ensure that we have professional renewal. These are the places that we get innovation stamped, and this is where systems are improved for us to be able to achieve UHC. They also are able to provide us with the structured spaces where the evidences that you're able to gather while you're working in the field, the experiences and the innovations are able to then meet policy and practice in one particular room. And for pharmaceutical professionals that you are in this room, this conference is very essential because it is helping us to accelerate knowledge translation. That is to make sure that the research findings that you have, the experiences that you've had in the field, and the global best practices that you've been able to come across are actually turned into practical protocols in where you serve and where you work. You also know that this is where we are able to build our professional networks. Today, I am living here with more than one card, and I have more than one interest as opposed to how I came in here. So this is also an opportunity for us to be able to enable those particular networks to thrive and use those particular networks to be able to help us solve problems in a very rapid manner across our the referral hospitals that we have around here, in the counties that we have, and also in the supply and the quality and the clinical challenges that actually arise around us every day. This is also an opportunity for us to be able to standardize things. You know, many people do many things differently, but this is an opportunity where we put our heads together so that we can have a standard way of handling things, a standard way of aligning our practices around our workplaces. And to say this quite plainly, you see, I am not a scientist and I am not a pharmacy expert, but this is what I think. Every pharmaceutical technologist and a pharmacist and all the allied professionals that we have should be part of this conversation, because your daily decisions, the ones that you make where you work, is actually what makes the difference in our healthcare system and in the well-being of our people. And that should be dear to us every day. A functioning health system depends on reliable access to both pharmaceutical and non-pharms, as you like to call them. And these supplies get to the national referral hospitals, the county health facilities, the private institutions that we have, the faith-based ones that we have. And when we have stockouts, like you all know, in this particular supply, you know, those are failures that will definitely undermine the clinical protocols. They will definitely delay the treatments of our people. And in the end, it erodes the public trust that we have with our people. And we must therefore, as pharmaceuticals and pharmacists that we are here today, technologists, we must prioritize what we call support for local capacity building, to make sure that every person that gets into contact with the people that need the services have this particular capacity so that they can be able to handle it properly and in the right way. And we must also make sure that we have stronger supply chain management systems that ensure availability, accountability, and the rational use of medicines and medical commodities. Because if we do not have the supplies flowing, we definitely have a problem. And one of the issues that we've had, or that I have had or experienced or had I've come in contact with, is the issue of lack of supply, especially in the counties. And when you talk to the pharmacist that is around there, they make it sound so easy for the hospitals to be able to have full-time supply of medicines and all that needs to be in the hospital. And I keep wondering, Where does the pharmacist come from, where they look at it and it looks so straightforward and simple, and where does the governance and the management of these particular facilities come from? Because they don't seem to be reading from the same page. And I feel like the solution that we need for our health and county facilities, whether in the counties or in the national government, get to have consistent supply of these particular commodities. I think the solution is with the pharmacy. For us to be able to sit down and really listen to what you have to say in terms of the solutions that we need to apply so that our people can be able to have these supplies across the year, even when the financial years are the corner. Now, ladies and gentlemen, the pharmaceutical technologists that are here, by virtue of your proximity to the patients and medicine, and I must say this, if there is one person that I have interacted with a lot of times, is that pharmacists. Is that pharmaceutical technologists. Because even last night as I left where I was coming from in Baringo, I remember that my 14-year-old has been complaining that they have this cough that makes them their chest feel painful. You know what I did? Because it was late in the night, I kept driving so that I can be able to find a pharmacy that was open. And I sure did find one at 11:30 p.m. When I found that particular one, I explained the sickness of my 13-year-old who is at home to this particular pharmacist. And of course, she was asking me a good number of questions. She did ask me, and she did give me a prescription medicine that I took to my girl back at home. You know, this is the person that we interact with every time, whether it is in the middle of the night, whether it is in the morning. This is the person that we actually interact with most of the time. And you know, the person who is able to then detect some of the early warnings and signals is this particular person. And I feel that this person should then be given an opportunity to be able to serve as the regulator's eyes and ears in the health system, because these are the people that get in contact with the issues that the consumers that you're trying to protect actually face most of the time. When you look at the World Health Organization Health Products and Technologies pillars, which is one of the pillars that they have, the health system strengthening depends on competent and well-deployed human resources who manage products, technologies, and information effectively. Pharmacy professionals contribute directly to this particular pillar. And when we get it right in this particular pillar, we will definitely go far as a country. Your work as pharmaceutical technologists strengthens the entire health product life cycle. And that goes without saying. We don't even need to justify it. Because, you know, from selection and the procurement to the safe use and proper disposal, it is all in your hands. How all that happens is in your hands. And as we pursue this integrated and patient-centered care, we must also confront the growing challenge of antimicrobial resistance, that is medicine misuse as well, and the adverse drug events, and also avoidable morbidity. And I have seen, if you look at the program that you have, on the top that says the sub-themes that we have around here. I did not know that that was going to come up, but I am glad that that is actually coming up here. The people who are able to look into this, the people who are able to sort this out, are the people who are seated right under this room. And to prevent all this and to be able to do this, you see, we have a lot of issues, and I'm sure the PPB is here today so that we can be able to talk about the enforcement of the prescription verifications and proper record keeping at all the dispensing points. We are able to then promote stewardship programs that is able to guide prescribers and dispensers on appropriate medicine use. Also, importantly, be able to educate patients on the dangers of self-medication. The first person that you need to educate right now is myself, who actually self-medicated for their child yesterday. And that is what happens every other time. That needs to be able to go out there, and for our people to be able to know how dangerous that is in the long run. Again, we must also support regulatory enforcement where unlawful dispensing occurs. And this is where the PPB actually comes in strongly. I know I can say a lot of things, and I know these things are normal to you. You talk about them every day, you see them every day, you actually do some of these things every day, and you advise against and for most of these things every day. So because I know there are experts in the room that can be able to speak to these matters more authoritatively than I can myself, I just want to close this particular speech by saying that I appreciate the organizing committee, the sponsors and the speakers that I have seen lined up in this particular program, and indeed all the partners whose dedication and hard work have made this important conference possible. Your efforts demonstrate a strong commitment to advancing pharmaceutical practice and strengthening healthcare delivery in Kenya. We appreciate that as a people, because without you, we're not able to sort that out. To all delegates that are present here today, I want to encourage you to engage actively in the discussions, to be able to share experiences openly and explore innovative and practical solutions that will shape the future of pharmacy practice in the UHC era that we as a country want to achieve as soon as possible. So good people, I want to wish you the very best as you enjoy your conference, and we are waiting for results back at home so that we can be able to enjoy the fruits of what you've been able to talk about here today. Lastly, before I officially open this particular conference, you know, many people are wondering, what did you say? Did you say that she was the youngest MCA or something? And I want to also to be an inspiration to anyone who wants to be a politician, especially the young people and women. You know, for men, everything is given to them. But for women, we must fight for our space all the time. So for any woman and any young person, because we have ageist, you know, previously we have juvenists. Right now we have ageists, people who have a problem with young people or the age that people have. We have news for them, that every person that is living under the sun has the opportunity, as long as they go out there and find what they want to be, they can be what they want to be. So to the young people here and to the women, do not let anyone's opinion matter to you. You go for what you want. Because at the end of the day, it is you who decides your future. So we amka na ufanye vile unataka. Hii maisha ni moja. What you need to be prepared for is a lot of things will come your way. So you must also be very strong, a very emotionally strong person. You also must be strong in terms of how you perceive and how you handle people. That is the only thing that you need to do so that you can protect yourself, so that you don't die while at it. Alafu unawaacha tena. So make sure that you're strong so that you can go out there. Other than that, anything and everything is possible. I went out vote hunting in 2016. 2016, I had graduated from the University of Nairobi with my first degree. I graduated in September. And by October, I was on the podium and I was seriously asking to represent the people of the great ward of Kilibwoni. Of course, I did ask, and I wasn't married like many women would be asked. Where is your mzee first of all before you talk to us about anything? And then you wonder, is the mzee able to make you speak, or what is it exactly supposed to do? But anyway, it was a very tough question that I had to actually deal with. So for anyone who is going out there, you know, just be brave and be able to, you know, handle your situation head on. Do not shy away from it, because it will definitely come back to you. So I did. I went to the podium and I asked for votes. And by the way, I ran as an independent candidate. And it was a time where Jubilee was a wave, but I still won against that wave that was Jubilee at that time. I did not just win. I won, and I actually went to the county assembly to do what they sent me to do, to be able to represent them, to be able to oversight the resources that are in the county, resources that are actually there predominantly for health, so that we can be able to sort out the human resource in health and be able to sort out the commodities in health. I did go there and I made all the legislations that we needed to do. Any law that needed to be domesticated, if you went to the county assembly of Nandi, Hansard today, you will find that I was able to do the legislative role in a proper manner. And we were able to do what we were able to do. And finally, what they were asking me to have in 2017 came in 2019. So I got married, and they again said they were not going to vote for me because I had gotten married to someone that did not come from that particular ward. So you see, hakuna msimamo, it is just what is convenient. So do not worry about those things. Just make sure that you're doing the right thing at the right time, at the right place. That is all that matters. So I got married again, and I went to another constituency, Mosop. So when I got there, I said, now I need to down my tools. Those ones on the other side are saying, I got married to the wrong place, so they were not going to vote for me. And these ones that I went to their place are saying, I have not had my roots deep enough, so they cannot also vote for me. at that point in time. And I'm wondering, where exactly do I belong? And you know, those are issues that only women face, not for men. Men can actually go anywhere, settle there 2 days, and they can get that particular seat that they want. Yes, that is how powerful it is. But the good Lord is also faithful, and he made sure that I had another calling to be the woman rep for Nandi. Of course, I went out there again on the campaign trail, and the issues don't end, by the way. So do not imagine that you will have an opportunity where you go out there and say that you want to be the Secretary General Nairobi branch or the national one, especially for women, and you don't have issues. They're always there. Can you imagine the kind of issues I faced? Again said, my kids were younger and my husband needed more of taking care. So I should actually abandon the politics and be able to take care of my husband and my children. And I'm like, wait a minute. But you said women have a sixth sense. They even have a seventh one, and they can be able to multitask. And I said, why are you not trusting me to do all that? Take care of my children. I have younger children by there, but they're well taken care of. And I have a well taken care of husband. Next time I'll bring him as evidence when I come to this particular conference again. So I said, good people, I can do this. I can do both. I mean, you can dispense medicine at the pharmacy or whenever you are, and you can still take care of your kids. Ama dispensing stops you from taking care of the other. That is the strength of women. We can do all those things at the same time. You know, that is the beauty. So again, I'm like, good people, forget about how I take care of my husband and my children. I'll handle it. Do not worry about it. What you need to be worried about is if you have a proper representative in Nairobi, if you have a proper representative at the National Assembly, who can be able to bring a motion that sorts out a problem that faces the people of Chebirir in Nandi County. A person who can bring a statement to ask questions about a situation that is unfolding in Chepterwai. Someone who can be able to contribute constructively and objectively to a motion or a bill that is on the floor of the House. Forget about the other things. I'll handle them between 6 p.m. and tomorrow 8 a.m. I can handle those ones. So be able to look at what you did in Nairobi. And the good people of Nandi gave me an opportunity to come to Nairobi. I hope in your own judgment I'm not doing badly off. Am I doing badly off? Am I doing badly off? They made a right choice, right? So I really want to encourage anyone who is here, who has a dream, whether political or any other space. It is open for you, and it is for you to take it. So please step up and put your things in order, and you can definitely do that anytime that you want to do it. As long as you've set your mind into it, you can definitely be able to do it. So of course, going into the future, I can see other people also have comments about what happens in Nandi County. And just for avoidance of doubt, so that you're not wondering whether it was true or it was rumors, in the coming elections of 2027, I am offering myself as a solid candidate for the position of governor in Nandi County. Kwani iko nini? Iko shida mahali? Yeah, and I look forward to an opportunity so that, one, I can stop talking about these things on a policy level and on a legislative level, and actually get down to doing it. So that when the pharmacists say this is what needs to happen, I can be able to give them audience and ask them, how do you want us to go about it? And ask them, how do you want us to sort this one out? And when you give the solutions, I give you the political goodwill that you need, and most importantly, I'll have resources that go to Nandi County, 9 billion or 10 billion. I'll give you the resources so that you can be able to sort out the issues in Nandi County and in Nairobi County, and indeed in the whole country of Kenya. So when the time comes for us to hit the road, I can assure you, and I want to ask you, that you ask anyone who cares to listen, that the best choice for governor in Nandi County for the health sector to be sorted out is going to be Cynthia Muge. And I'll do a good job so that I can bring back the returns, and we can be able to speak about the successes that we've had so far in all the sectors that are devolved in Kenya under the Constitution of Kenya 2010. So I know I have said a lot of things. I want to say that I hope I have not earned myself a cutting off the list of the people to be invited next time. I hope to be able to come here again next time so that we can be able to take stock in regards to where are we from where we left it last year, and we are able to see what is the progress we have made. So with those very many remarks, it is now my distinct pleasure and honor to officially declare the Kenya Pharmaceutical Association Nairobi Branch Annual Scientific Conference 2026 officially open. Thank you, and I wish you a fruitful deliberation and a successful conference.
Thank you. Thank you. If you needed encouragement, look no further. I request you stay. Thank you. Now, watu wa Nandi, mumesikia. If you have a friend kutoka Nandi, umesikia. Or befriend somebody from Nandi. Or if you can adopt someone from Nandi. Ametosha ama hajatosha? Ametosha ama hajatosha? Wao ndio wamesema. So talk to your friends from Nandi. Again, another thing that she has said, please don't be afraid to go for that big dream that you have. Whether you are a lady, whether you are a man, you can do it. She did it. And she's still going to do much more. So continue pursuing that your dream. So, Honorable, from the KPA side, we really appreciate attending our conference and officially opening our conference. And we can assure you that we shall continue inviting you to the forthcoming conferences. From the KPA, we have a small token of appreciation from you, and I'll request the Deputy Secretary, KPA Nairobi branch, to come with the present, and I'll request Muzembugwa, our trustee, to come and hand over the gifts.
The chairman of North Rift is from Nandi, and she's a lady.
Thank you, thank you. So you can present our small token. Thank you. Thank you, and yeah, size. Asante sana, tumpigie makofi. With us also we have our regulators who we are working up with, and we also have a small token of appreciation for them. And I'll request Dr. Asha to come in front to Isha to come in front to receive the gifts. And I'll request the Chair KPA Nairobi branch to come present the gift. Chair KPA Nairobi branch. Thank you. I'll also request Dr. Morris Onditi Kodiambo then to present the gift on behalf of NEC. I'll request Mr. Boaz Dulo to come and present the gift. Thank you. Thank you. Next, I'll invite Mr. Mayo. Oh, okay. As we are waiting for Mr. Mayo, I'll invite one of our own, Miss Sarah Kisilu. And for Miss Sarah Kisilu, I will request Laura. Laura, you just know, to present the gifts. Thank you, and to our guests, feel welcome. You don't need to be in a hurry to leave. We want to be with you here up to tomorrow, and Feel welcome at KPA, and especially KPA Nairobi branch. Ladies and gentlemen, let's take the next 1 minute just to appreciate our guests. Let's just clap for them. Thank you. So at this juncture, allow me to invite the first scientific presenter of the day. And the scientific presenter is one of
standard. Because these are employment opportunities. And if we can succeed, I think we are now at facility number 7, zenye zimeenda 24 hours. When we reach number 125, swali ni, Cletus utanunulia lunch kwa sababu tutakuwa tumeandika 125 farmtechs. Because that is what must happen. So that by the time we are advertising, there is already members who are already on contract, and so we are agitating on the basis of turning them into permanent and pensionable. The other aspect that I think I wanted to mention, but nimeona tu members wangu wawili, ni kwamba yes, we are going to process those promotions. I was with waliniambia nisiseme hivi, KEPHPHU. Are we members of KEPH Kefufu? Na niliambiwa nisiseme hivyo, lakini wacha tu niseme. Are we members of that? Are we members of the union? Naona hapa. Naona wengine hawajui kama hao ni members. Maybe niulize, unakatwa? Kama ukatwi, then wewe sio member. Kama unakatwa, wewe ni member. Why I'm raising this is because for the members who are in Nairobi, we are working on streamlining a certain number of things. Okay? And I know there's always a conversation between the association and the union, and I don't think I want to really go into that. But the point that I wanted to tell the members who are here, who are represented, is that there's actually a team that has compiled the list, and that will be processed. So for the members in Nairobi, anyone who stayed 3 years and above, guaranteed, hiyo do inakuja through the promotion. So that is something that I can share. So the last thing that I want to say is that we will open additional facilities. The challenge that I keep on asking myself, and this is the last challenge, then I can bring it to a close. If your child was to collapse outside the facility where you work, if your child was to collapse na hauko hapo kwa hiyo facility, na hiyo siku hauko kazini, na hawajui ni mtoto wako atapata huduma kamilifu? How many think that they are comfortable with the quality and level of care that we give in our spaces as professionals? That if you are not there, there would be good quality care when you are not there. Munainua mkono kwa sababu you are comfortable. If your child was to land in your workspace, they would get quality of care. You are comfortable. Because that, I think, for me, is the challenge of professionalism that we all must be true to. That, for me, is the headache that I feel, and I hope I try to address every single day. Can the service delivery points that we serve, can it give the quality that we, me and you, need? And as long as the answer is maybe, as long as the answer is we hope so, as long as the answer is a straight no, then our work is cut out ahead of us. Okay? And so I want to pause there as I throw that challenge to us. Just know from Waziri's office and from the office of the DMS, and that we are here to support, and we will continue to engage. Thank you very much for the invitation, and thank you for the opportunity to address the members. Asante.
Thank you so much, Daktari. We appreciate, and when you get back, please say a big thank you to the CC Health. We appreciate the collaboration that we are having with the KPA. now that you represent the county, I know it is in the interest of this great membership of KPA Nairobi that many a times as their leaders, we have received several calls of public health officers visiting their community pharmacies. In the process, they feel harassed. But again, these officers do not work together with the Pharmacy and Poisons Board inspectors. I want to affirm whether I am representing the position of the members. Is it true? Daktari, that is not my voice. It is the voice of these members. All right. Secondly, I know you will be running another round of employment opportunities. We are kindly and humbly requesting you to consider before the advertisement, if there were to be 200 farm techs, just add 100 so that they can be 300. Now that you visited us and you can see, yes, you can see when you asked for them to raise their hands, there were only 3. Iko njaa, tafadhali. Lastly, we have a union for pharmaceutical technologists in this country. That union is called Kenya National Union of Pharmaceutical Technologists. Yes. That union represents the Kenyan pharmtechs, including Nairobi County. And therefore, we shall, working together, KPA with that union, we request to visit your office together with the office of the CC to discuss more matters concerning workforce, employment, and community pharmacy practice. Thank you so much.
Do I respond? Sasa tena mtaki kula lunch. This is more important. Okay. So let me start with the last one. Yes, you have my contact. Ofisi iko Nyayo House. Na wakati mnakuja tafadhali mkuje na members of staff who are sitting in CHMT so that it becomes easier to action our resolutions. When we mukiwa na mtu ndani ya bedroom, si nakuwa rahisi kunyorosha vitu. So that one is easy to straighten up. I was with Knupt 2 weeks ago in Mombasa as we try to resolve the issues that need to be resolved. So and what I told the unions was that as far as I'm concerned, your members are my team before they are your members. Kweli au urongo? So there is nothing to fight over. And I don't understand, pesa ya serikali sio ya mama ya mtu. Gosh, imeshikwa kwa kamera hiyo. So there's nothing we are fighting over. Those who need to be promoted, let them be promoted when we need the numbers. Now, why I mentioned the Taifa Care landscape, as I said, if you remove the politics of personalities, the Taifa Care landscape is changing a lot of things. What you may not appreciate, but which is a headache for me, is that, for example, Nairobi County has, for every 1 public facility, there are 10. And I suspect there is at least 100 pharmacists, chemists, community, zenye zinahudumia wananchi hapo nje. I know that because I used to be the sub-county MOH for this area. And once we did a census for chemists and pharmacies between Roysambu roundabout and Kamiti prison. And we didn't have a public facility, but we had 180 chemists and pharmacies and clinics, most of them unregistered. So I know that one of the responsibilities that I have is to expand public service facilities. And the reason why that must be there and why I know we will be employing, whether it is this year, this month, or after 6 months, or after 2 years, is because we must expand public sector services. And why must we do that? Because most Kenyans sit in a certain economic space. The bulk of people that you see around wanaoperatigi kitu inaitwa hand to mouth. So, for those who run the too small to clinics and the too small to pharmacies, jua that you are at risk from me and the work that I'm doing, because we are going to push, Kasarani Health Center is behind here, sindio? To run 24 hours and to open a pharmacy that actually has all the commodities. That might mean that one of your members is going to get work. But it may also mean that another member who runs a substandard pharmacy or chemist is going to be at risk. Now, which one should I support? So mimi naegemea pande ya kuhakikisha kwamba we bring up the standard of public that will push the private to also do what? To go higher up. Because kama naweza afanya kila kitu kwa public, then the only reason why you are going kwa private ni juu ya TLC, tender loving care, si ndio? Ukiingia wamepaka rangi, wako na soft music hizo. So mujue hiyo inakuja. And why do I know that that is going to happen? Because in the last 12 months, between April and December, SHA has compensated public facilities 1 billion shillings for care. And that 1 billion shillings inatumika kubadilisha vitu. Shida ya government facilities ni, the first thing we did was not to employ additional farm techs, ni kuweka CCTV na kabro. But after umeweka mara moja, sasa tutaanza kuweka hizo vitu zingine. I am hoping that now we are aware that public facilities have all the essential medicines in them. Is that true or false? It's false. In Nairobi, members wangapi wako Nairobi, wenye wanafanya kwa Nairobi, munipatie tu majina ya hospitali zenye hazina EMMS. Because as far as I'm concerned, I know that there is an allocation for 20% for drugs. So that is 200 million shillings worth of drugs that is supposed to have come to Nairobi. The headache we are having, sijaanza hata kujibu swali, gosh. The headache we are having is who is supplying. And I'm coming across all sorts of funny things. Tulikuwa tumesuggest, again on behalf of your members, let me just suggest, tulikuwa tumesema tunafaa kufuata sheria ya AGPOA. Munajua AGPOA? Procurement targeting youth, women, and those with disability. So gender friendly and youth friendly. So again, those are opportunities that are opening. But how is KPA prosecuting the matter formally through our offices? When we come, maybe we can have deeper conversations on the same, so that your members can be able to supply. Ama dawa zitatolewa wapi? Baba dogo kwa Wahindi? Sijaona Muhindi. Nisikuwe natupa mawe na kuna members wenye ni Wahindi. So anyway, that's besides the point. Let's prosecute that issue. The first issue was the visits by PHOs. So employment we will give because we must expand services. But your members run chemists and pharmacies out in the community. There are two perspectives to this question. The first one is there are people who wake up in the morning, take a shower, dress very smartly, hata wanaweka hizi vitu zinanuka manukato. But their main agenda for that day is to harass other people. They are there. Some of them are our relatives. True or false? Because jioni si tutakuwa mahali social. Na unajua ujamaa mshahara yake ni 15k. Lakini amerusha around tangu 6 p.m. na inaelekea midnight. Hiyo do inatokanga wapi? Sinatoka from harassing your other colleagues. The best way to fight this is usually what I call the kuwasha taa. Mnajua cockroaches? Usiku cockroaches zinafanyanga nini? Zinatokanga, si ndio? So if you are in certain environments, for example, if you're in the kitchen or if you're in the washroom, ukiwasha taa, what happens? Cockroaches zinafanya nini? Until you start first having the leadership pick up the cases and identify, mulika mwende. Until you do that, as long as your member is being fought as an individual, they can't fight back. But as long as the phone calls are coming to me and saying, there is our member at such and such a place, and there is a team of public health officers who've come, and they've identified themselves as so and so, so and so, and so and so, and we are not understanding what it is they've come to do, they will always continue harassing your members. So maybe one solution that you must deploy is you must switch on the light. And in this case, switching on the light is making sure information comes to the surface. Let it be open that indeed this is not okay. But I said there are two aspects to this conversation in my view. The other aspect is, why are you running a business without license? Because wewe ndio unafungua hiyo mlango yenye watu wanaingia. Kuna mwenye anakutafuta mahali umesimama innocently, si ndio? Lakini kuna wengine wetu, license ya shilingi 5,000 ni ya shilingi 5,000, 15,000. Wakikutembelea mara 4 utakuwa umelipa pesa ngapi? Shilingi 20,000. So now which is easier to deal with? You get my point? And it's not like there is anything I can do when the governor says businesses are supposed to pay a certain rate. I can't fight the governor. He is my boss's boss. So he's too high up. And he has his reasons and he has his realities that force. So when you need to pay for that license, why are we having a conversation? Because what you've done is you've allowed a window through which the other people can now come and shake you down. And they will shake you down. Na ukimalizana na person A, akirudi kwa ofisi atatuma person B. Sio yeye atarudi kesho na kesho kutwa. Even pharmacy and poisons board inspectors wanakujanga professionally, ama wanachezanga kivyao? Si hata wanacheza kivyao. So as long as you don't have the right licenses, naomba wenyorosha, then now through Mbitu's office we can now get formal. There is a team that is harassing our members. Our members have the requisite licenses to operate and run their businesses. Can we deal with this? Then because I sit with the Director Public Health, and yesterday I was with him from 8 a.m. to 5 p.m., it becomes easy for me to resolve the issue. Because I'll call him and tell him, hii team yako, hebu manage. Tunaelewana? And that is the difference between kununua lunch ya 500 ya urafiki na kutoboka 20,000 kwa sababu umeletewa ile pickup yetu chafu ile ya Kajo kuja kukuingiza huko ndani, and you've been told kuna room fulani City Hall yenye either utoboke ama ulale huko, si ndio? So I am also challenging you to do the right thing, but at the same time, it is not okay that some people come to harass members. But do I know who they are? No, until you tell me who it is, so that then we can address. Agreed? I think I've addressed the three. And again, I want to say thank you. We are in this together. Your members are my team, and me, I take care of my teams. Thank you.
Thank you so much. Tumpigie makofi. Daktari amesema maneno mazuri. Ya kwanza, mulika mende. That is a message we are living with. Tumulike Mende. Lastly, Daktari, hawa Mende, hawa Mende, they come not to look for licenses, but to do some inspection. So hiyo tutakutana, tutaongea. Thank you so much. When you get back, please pass our regards to the entire county team. We highly appreciate. When you come to KPA Nairobi, we love visitors, and therefore we wish to gift you before you can leave. So, Treasurer. Not that gift. All right, so I will call upon the SPPT. Daktari, SPPT is Senior Pharmaceutical, Principal Pharmaceutical Technologist. He sits at the Ministry of Health, and I would want him to have the privilege and the opportunity to gift you this award. SPPT. Thank you. Thank you. Thank you so much, Daktari. Tumpigie makofi vizuri. Asante, asante. Bwana MC, please come take over and tell us the next step.
Thank you. And I know currently we are a little bit hypoglycemic, but I'm requesting for only a maximum of 2 of your minutes. We had a scientific presenter who has presented to us on research, and that's our member who has given us hope. Diploma in pharmacy is not the end of education. He has gone to did up to a PhD. Allow me to take this opportunity to welcome him back on stage as we are going to award him something for the good work he has done. So, Dr. Francis Karibu. And to present the gift, allow me to welcome Honorable Deputy Secretary General, Honorable Mercy Karibu. Thank you. Thank you. Thank you, Daktari. Now, we have to make a decision. Tuendelee ama tuende lunch kidogo? Good, thank you. Now, the program is packed and lazima tukubaliane. We are breaking for lunch. Lunch is ready. Meal cards will be issued at the exit, but I'm requesting that we be back here at exactly 3:30 p.m. Sio iko sawa? Na tusiende nyumbani. There are gifts for each and every attendee of this conference. So hapo jioni tukirudi, ndio tutakuwa tunapeana more gifts, and more gifts. Sawa? Sawa, sawa. Asante. Who feel blessed that want to pray for lunch? Chair, kindly pray for your people. Pray for lunch.
I've been ambushed. Thank you so much. Let us pray for lunch. Lord, we come before you this afternoon. We have something to eat and to drink. May you bless it as we take it. We pray this believing in our Lord. Amen.
Thank Thank you. Let's meet at 3:30, exactly 3:30. The program